Is TMS maintenance therapy effective for bipolar stability? Imagine a treatment that gently encourages your brain to find balance without the need for pills or invasive procedures. Transcranial magnetic stimulation, or TMS, is a non-invasive technique that uses magnetic fields to stimulate specific areas of the brain involved in mood regulation. It is mainly studied for treating depression in bipolar disorder, especially during depressive episodes. But what about using TMS to help keep mood stable over time? That's where maintenance therapy comes in. Research suggests that after an initial course of TMS treatment, ongoing sessions might help prevent depressive symptoms from returning. These maintenance sessions are typically shorter and less intense than the initial treatments. They often involve fewer pulses and shorter durations, making them easier to fit into a routine. Some studies have shown that patients who continue with maintenance TMS experience fewer depressive relapses over months compared to those who stop treatment. For example, in bipolar depression, patients who received maintenance TMS along with their medication showed stable mood scores and fewer depressive episodes during follow-up periods that lasted a year. Importantly, these studies did not find an increase in manic symptoms, which is a concern when treating bipolar disorder. While these findings are promising, it's important to remember that research is still ongoing. The number of studies is limited, and protocols vary widely. There are no official, standardized guidelines yet for using TMS as a maintenance treatment in bipolar disorder. However, in cases where patients respond well to initial TMS and continue to experience mood swings despite medication, doctors might consider maintenance TMS as an additional tool. It is usually used alongside mood stabilizers and other treatments, tailored to each person's needs. Compared to other maintenance options like medication, some evidence suggests that TMS can be effective with fewer side effects and better tolerability. For instance, in treatment-resistant depression, maintenance TMS has shown similar effectiveness to lithium in preventing relapse, but with fewer adverse effects. This makes it an attractive option for some patients who find medications difficult to tolerate. Despite its potential, TMS maintenance therapy is still considered an emerging approach. Larger, more rigorous studies are needed to confirm its benefits and establish clear guidelines. Currently, it is not universally recommended as a standalone maintenance treatment, but can be a helpful addition for certain individuals. If someone with bipolar disorder is considering TMS for stability, it's essential to discuss this with a healthcare professional who can evaluate the risks and benefits based on personal health history. In conclusion, maintenance TMS shows promise for helping people with bipolar disorder stay stable, especially in reducing depressive episodes. It appears to be safe and well tolerated when used carefully. But because research is still developing, it should be viewed as a complementary option rather than a replacement for established treatments like mood stabilizers. Always consult with a healthcare provider to determine the best approach for your unique situation. And remember that ongoing research continues to shape how we understand and use TMS in managing bipolar disorder.